She was 69 years old, a retired nurse, someone who had spent 4 decades taking care of other people's hearts. She knew the warning signs. She knew the symptoms. She had educated hundreds of patients over her career about exactly what to watch for. And on a completely ordinary Thursday morning, she did what she had done every single day for the past 11 years, without thinking twice about it. She got up, walked to the kitchen, made her coffee, and sat down to read the news. By 8:15 in the morning, she was in the back of an ambulance. I was the cardiologist on call. I reviewed her case, I sat with her afterward, and the first thing she said to me, this woman who had spent her life in medicine, was, "I did not feel anything wrong. Nothing. I felt completely normal." That is one of the most dangerous sentences I hear in my practice. Not, "I ignored the warning signs," not, "I knew something was wrong," completely normal. Because the morning habit that put her in that ambulance was not something she recognized as harmful. It was something she had done thousands upon thousands of times before. Something so ordinary, so routine, so deeply woven into everyday life that most people never stop to question it. And the truth is, if you are over 60, there is a very good chance you are doing the exact same thing. Before we go any further, let me ask you something. Have you ever stood up in the morning and felt just a little lightheaded for a second? Have you ever felt a brief wave of dizziness that disappeared so quickly you ignored it? Have you ever noticed your heart beating harder than usual after getting out of bed, only to dismiss it because it went away? Or perhaps you've told yourself, that's just part of getting older. If any of that sounds familiar, then I want you to stay with me, because what we're about to discuss could change the way you start every morning for the rest of your life. My name is Dr. Natalia Wright, and welcome to Dr. Natalia Wright Senior Health. For decades, I have worked with older adults, helping them understand what really happens inside the body as we age. What I've learned is that some of the greatest risks to our health are not dramatic events. They are not the things that make headlines. They are often small, everyday habits that seem harmless because we've been doing them for years. Yet those habits quietly interact with an aging body in ways that most people never realize until a problem occurs. And I wonder if you've ever experienced this yourself. Have you ever looked back on a health issue and thought, if only someone had told me sooner? Have you ever felt frustrated that information appeared only after a diagnosis instead of before it? How many times have you sat in a doctor's office wishing someone would simply explain what was happening inside your body in plain language? Those questions matter because today's conversation is not just about heart attacks or blood pressure. It's about understanding your body well enough to prevent problems before they begin. The reality is that most people think danger comes from major decisions: smoking, poor diet, ignoring medications. Those things absolutely matter. But some risks are hidden inside routines so familiar that we stop seeing them altogether. They become invisible. And invisible risks are often the most dangerous of all. To understand why, we need to talk about what happens during the first moments of your day. Most people imagine waking up as a simple event. You open your eyes, you get out of bed, and your day begins. But biologically speaking, waking up is one of the most dramatic transitions your body experiences every single day. During sleep, your body enters a state of relative recovery. Heart rate slows, blood pressure decreases, muscles relax, energy demands drop. Your cardiovascular system enjoys a period of reduced workload. It's one of the reasons sleep is so essential. Those nighttime hours give your heart an opportunity to operate under less strain. Yet something remarkable happens before you even become conscious. About an hour before awakening, your body begins preparing for the day ahead. Hormones start shifting. Cortisol begins rising. Adrenaline gradually increases. Your nervous system starts turning the lights back on, so to speak. It's as if your body is warming up the engine before the driver even enters the car. This process is perfectly normal. In fact, it's necessary. Without it, you'd struggle to wake up and function. The problem is that after age 60, the body doesn't always respond to these changes the same way it once did. Think about a brand new rubber band. It's flexible, it stretches easily, it snaps back into place. Now imagine a rubber band that's been sitting in a drawer for 20 years. It still works, but it isn't quite as flexible as before. Blood vessels behave similarly. As we age, arteries naturally become less elastic. They become stiffer. They don't expand and contract with the same ease they once did. At the same time, many older adults develop some degree of plaque buildup within their arteries. Sometimes it's significant, sometimes it's mild. Often it causes no symptoms at all. That's what makes it so deceptive. You can feel perfectly healthy while changes quietly develop beneath the surface. Imagine a highway carrying traffic every day. Over time, small cracks appear in the pavement. The road still functions. Cars still move. Nothing seems wrong from a distance. But eventually, those small vulnerabilities matter. Under the right conditions, stress on that roadway can produce sudden consequences. The cardiovascular system works much the same way. Now let's add another factor that almost nobody thinks about: dehydration. Every morning, after 7 or 8 hours without fluids, you wake up slightly dehydrated. Not severely dehydrated. Not enough to make you feel thirsty necessarily, but enough to influence your circulation. Throughout the night, your body loses water through breathing. You lose moisture through your skin. Meanwhile, no new fluids are entering the system. As a result, blood becomes somewhat more concentrated by morning. Many people underestimate the significance of this. They think dehydration only matters during hot weather or intense exercise. But even mild overnight dehydration can increase the workload placed on your cardiovascular system. Now imagine combining those three realities: rising stress hormones, stiffer blood vessels, slightly thicker blood. Already, before your feet touch the floor, your heart is working under conditions that are very different from those it experienced during sleep. And here's something many people find surprising. Heart attacks and strokes are not distributed evenly throughout the day. They occur disproportionately during the morning hours. Researchers have observed this pattern repeatedly. The window between approximately 6 a.m. and 10 a.m. is particularly significant. Why? Because all of those physiological changes are occurring simultaneously. The body is transitioning from rest to activity. Hormones are rising. Blood pressure is increasing. Heart rate is accelerating. Blood vessels are constricting. Circulation is adapting. Everything is changing at once. For a healthy, resilient cardiovascular system, this transition may happen without issue. But for an older adult with hidden vulnerabilities, the morning can become a period of heightened risk. And that brings us to the habit almost nobody recognizes as dangerous. It is not smoking. It is not eating bacon. It is not forgetting medication. It is not something dramatic or obvious. It is rushing your body from sleep into full activity without giving it time to adapt. Now, when people hear the word rushing, they often picture someone running late for work. That's not what I'm talking about. I'm talking about the alarm sounding, your eyes opening, your feet immediately hitting the floor, and your body moving from complete rest to full activity within seconds. No pause, no transition, no preparation. Just instant movement. For many people, this happens automatically. They have done it for decades. They never question it. But after age 60, that seemingly harmless routine can place an enormous demand on the cardiovascular system. To understand why, picture a snow globe sitting perfectly still. Everything inside is calm and settled. Then suddenly, someone shakes it violently. The contents immediately shift and swirl. A similar process occurs inside your body when you move abruptly from lying down to standing. While lying flat, blood distribution remains relatively balanced. The moment you stand, gravity exerts an immediate effect. Blood begins moving downward toward the legs and abdomen. Your body must respond instantly. Blood vessels constrict, heart rate increases, circulation adjusts. Pressure must be maintained so the brain continues receiving adequate blood flow. This adaptation is incredibly sophisticated. It's one of the many miracles occurring inside you every day without conscious effort. But aging changes the speed and efficiency of that response. Some older adults experience a brief drop in blood pressure after standing. You may know this sensation well. Perhaps you've stood up and felt momentarily dizzy. Maybe your vision dimmed slightly. Maybe you felt unsteady for a second. Most people dismiss those moments. They say, "I'm just getting older." But your body may actually be sending you a message. It may be telling you that the transition happened faster than your cardiovascular system could comfortably handle. And what concerns me is that millions of older adults have normalized these warning signs. They have experienced them so many times that they no longer view them as meaningful. Yet every symptom is information. Every signal tells a story. Every moment of dizziness is your cardiovascular system communicating something important. The challenge is that we often stop listening. And in the next part of this discussion, we're going to explore what happens inside the heart itself during those critical morning moments, why some seemingly healthy seniors experience sudden cardiac events without warning, and the simple 5-minute morning protocol that may dramatically reduce stress on your cardiovascular system before the day even begins. The reason this conversation is so important is that most cardiovascular problems do not begin with a dramatic collapse. They begin with years of small stresses accumulating silently. The heart is remarkably resilient. It compensates. It adapts. It works harder when necessary. It keeps going when conditions are less than ideal. In fact, one of the greatest strengths of the human heart is its ability to continue functioning despite challenges. But that strength can also become a weakness because the heart often suffers quietly long before symptoms become obvious. When I sit across from patients after a cardiac event, I frequently hear the same phrase, "I felt fine." Sometimes they were walking every day. Sometimes they were gardening, traveling, playing with grandchildren, and enjoying retirement. Nothing felt wrong. Yet beneath the surface, changes had been developing for years. Small plaques had formed. Arteries had gradually stiffened. Blood pressure had slowly crept upward. The body had adapted so effectively that the person never realized anything was happening. That is why understanding the morning transition is so valuable. It shines a light on one of the few moments each day when hidden cardiovascular weaknesses may reveal themselves. Let's look more closely at what happens inside the heart during those first few seconds after standing. Imagine that your heart is the pump responsible for supplying every organ in your body. While you are lying in bed, that pump operates under relatively stable conditions. Then, suddenly, gravity changes everything. Blood shifts downward, pressure changes. The heart must immediately increase its effort to maintain circulation to the brain and the rest of the body. For younger adults, this adjustment happens so smoothly they rarely notice it. Their nervous system reacts quickly. Their blood vessels respond efficiently. Their cardiovascular reserve is substantial. But after age 60, several factors can complicate that process. Blood vessels become less responsive. The nervous system may react more slowly. Medications can influence blood pressure regulation. Existing heart conditions may reduce adaptability. An underlying plaque can make arteries more vulnerable to sudden pressure changes. This doesn't mean standing up is dangerous by itself. The human body was designed to stand, move, and function. The issue is the speed of the transition. The faster the demand, the greater the stress. Think about lifting a heavy box. If you prepare yourself, engage your muscles, and lift carefully, your body handles the load much better. If you jerk the box upward suddenly, your risk of injury increases. The weight may be identical, but the way you approach it changes the outcome. The same principle applies to the cardiovascular system. One of the most overlooked truths in senior health is that the body often responds better to gradual change than sudden change. This is true for exercise, it is true for nutrition, it is true for blood sugar regulation, and it is especially true for cardiovascular function. I remember meeting a retired school principal who was 74 years old. He had always considered himself healthy. Every morning, he would jump out of bed, walk directly downstairs, make coffee, and begin reading emails. Occasionally, he noticed a pounding heartbeat during those first few minutes, but he ignored it because it disappeared quickly. Eventually, the episodes became more frequent. One morning, the pounding was accompanied by dizziness. A few weeks later, he experienced a brief fainting episode. When testing was performed, we discovered an underlying rhythm disturbance that was being triggered most consistently during the abrupt morning transition. What struck him most was not the diagnosis. It was the realization that his body had been sending signals for months. He simply didn't know what they meant. How many people watching right now have experienced something similar? Perhaps not fainting, perhaps not a diagnosed arrhythmia, but maybe subtle clues. A racing heartbeat, morning dizziness, a sense of imbalance, unusual fatigue, a feeling that something isn't quite right. If so, I want you to understand something important. Symptoms are not weaknesses. They are information. The body communicates continuously. The challenge is learning how to listen. Another reason the morning period deserves attention is because of what researchers call the cardiovascular surge. Most people think of blood pressure as a fixed number. They assume it remains relatively stable throughout the day. In reality, blood pressure follows a rhythm. It decreases during sleep and rises during waking hours. That rise is normal. However, in some individuals, the increase becomes exaggerated. This phenomenon is sometimes referred to as the morning blood pressure surge. For people with hypertension, diabetes, existing heart disease, or vascular disease, that surge may be particularly significant. Imagine driving a car across a bridge every day. If the bridge is structurally sound, traffic passes without issue. But if there are weaknesses in the structure, periods of heavy traffic place additional strain on vulnerable areas. Morning circulation functions similarly. The cardiovascular system experiences a natural increase in demand. If vulnerabilities exist, that demand becomes more consequential. This is one reason many cardiologists encourage patients to pay attention not only to what they do, but also to how they do it. The details matter, the timing matters, the transitions matter, and surprisingly often, small adjustments produce meaningful improvements. One of the biggest misconceptions about heart health is the belief that only large interventions matter. People imagine dramatic dietary changes, extreme exercise programs, complicated medication regimens, expensive treatments. Those things certainly have their place, but some of the most powerful cardiovascular improvements begin with simple daily habits repeated consistently over time. The heart responds to patterns, not occasional heroic efforts. Patterns. A healthy breakfast pattern, a hydration pattern, a sleep pattern, a movement pattern, a stress management pattern, and yes, a morning transition pattern. When those patterns improve, the heart often benefits in ways people don't expect. I want you to think for a moment about how you currently wake up. Do you use an alarm? Do you reach for your phone immediately? Do you begin checking messages before you're fully awake? Do you stand within seconds of opening your eyes? Do you rush mentally before you've even started moving physically? Because here's something many people overlook. The body doesn't distinguish perfectly between physical stress and psychological stress. The moment you begin worrying about appointments, finances, responsibilities, family concerns, or world events, your stress response system activates. For many seniors, the first thing they do each morning is expose themselves to stress. News alerts, emails, text messages, social media updates, medical worries, financial concerns, political headlines. The brain begins racing before the body has even completed its transition from sleep. That's a tremendous amount of stimulation during a period when the cardiovascular system is already working hard to adapt. I often encourage patients to think of the first few minutes of the morning as a protected zone, not because life should be avoided, not because responsibilities don't matter, but because your body deserves a chance to stabilize before the outside world begins making demands. Imagine greeting your heart with patience instead of urgency. Imagine allowing circulation to adjust naturally. Imagine beginning the day from a position of stability rather than acceleration. That shift may sound small, but small shifts repeated every day become powerful over time. In fact, One of the most fascinating things about cardiovascular medicine is how frequently modest interventions outperform expectations. People assume improvement requires massive effort, yet often the body responds remarkably well to consistency. A few minutes of hydration, a few minutes of gentle movement, a few minutes of controlled breathing. These actions may appear insignificant individually. Collectively, they create an environment in which the cardiovascular system can function more efficiently. And perhaps most importantly, they reduce unnecessary stress during one of the most vulnerable periods of the day. Now, before we discuss the exact 5-minute protocol that many older adults have found transformative, there is another critical piece of the puzzle that deserves attention. Because what happens after standing up may be just as important as standing up itself. Many people unknowingly combine multiple cardiovascular stressors into the same 5-minute window every morning. They rise abruptly, walk immediately, consume caffeine immediately, expose themselves to stress immediately, and sometimes even begin exercise immediately. Each action alone may be manageable. Combined together, they can create a much greater physiological load. And understanding that combination may completely change the way you think about your morning routine. We'll explore exactly how that happens next.